COVID-19, which originated in Wuhan in China, spreads around the world. People around the world are failing to hide their anxiety and fear. As of March 8th, there are over 80,000 people confirmed Chinese and over 3,000 people dead. Korea is the second largest country in the world that the number of confirmed cases was over 7,000 and Korean death toll is the fourth highest in the world among 50 people deaths. Today I am going to chat about COVID-19 symptoms and prevention. Also, let's take a look at South Korea deal with COVID-19 and current virus state of the US. Why is Korea the second largest number of confirmed cases in the world? It's because of the Shincheonji incident. Have you heard about the Shincheonji incident? Patient 31 who was diagnosed with the Shincheonji Jesus Bridge of pseudo-religion in Daegu, South Korea, showed infection and the doctor recommended twice a coronavirus test. She refused the test, went to work shift, went around, and rapidly infected many people with the coronavirus. After all, there are currently over 4,000 infected people in Daegu. There are 33 South Korea deaths in Daegu, 15 in Gyeongbuk, and 1 in Gyeonggi-do, 1 in Gangwon-do. Let's take a look at the symptoms of coronavirus. Symptoms of coronavirus. It is similar to common cold, fever over 37.5 degrees, cough, phlegm, etc., difficult to breathe. Pneumonia, yellow phlegm, severe cough. However, as recently confirmed cases of asymptomatic infection have increased anxiety. Coronavirus prevention. Wearing a mask. It's really hard to buy a mask these days, but if you have a cotton mask, make sure to wear it to fit your face size and wash it very often and dry it well. Strength immunity. Take vitamin drink warm water more often than cold water that reduces immunity, and eat warmer and healthier than cold food. Wash your hands often. Keep at least 20 seconds of hot water rather than cold water in the back of your hand, nails, etc. Don't go to many people in place. Coronavirus have a 14 days incubation period and have asymptomatic patients, so if possible, avoid going to many people. Avoid touching your eyes and nose, mouth with your hands. The most common infection method. Korea's countermeasure. Even after the winter break, Korean schools extended the start date by 3 weeks. Many are staying their home and the government is spending 7 billion won on mask supply. In the pharmacy, post office, 농협, or medical period of supplies for about almost $1 per mask. Limited quantity per person. The Korean government conducts a free coronavirus test on all citizens free of cost, with nearly 113,000 testers and 40,000 people being tested. In addition, suspected subjects in public health center or medical period can be quarantined. Self-isolation rules exist. During the self-isolation period, there is fixed expenditure every month, but they cannot go to work, they cannot make money, what if they cannot go outside and have no food at home? However, the Korean government support up to 130,000 won per person per day. Also, depending on the number of family members, one person 454,900 won, two people 774,700 won, three people 1,002,400 won, four people 1,230,000 won, five or more 1,457,500 won per month support. Relief supplies are also available to families who are self-contained. A courier arrives at your home, which include mask, disinfection, water, thermometer, and some food. If you leave the house without permission, the fine was less than 30 million won. Recently, many isolated have been forced to leave the house because their self-container want to eat something special soup, their spouse miss, or starved. Frequently, many segregators have been forced to leave, and the penalties have been tightened up to 1 year in jail or fine of up to 10 million won. Started March 7th, the Self-Isolator Safety Protection app developed it, and the punishment for unauthorized departure of self-isolator is expected to be reinforced. Self-isolating app is installed on the user's smartphone to take advantage of the GPS function. The device to sound an alarm when the self-isolator leaves the specified location. The Korean government is committed to fighting coronavirus. Coronavirus is really terrifying. In the US, coronavirus confirms and deaths are increasing, which are no longer safe here. What about the US now? Prior to the coronavirus, the US reported that the flu killed 10,000 people this winter. Many people died of flu before the coronavirus. Even in the US, where the early stages of coronavirus separation have occurred, that are over 464 confirmed. Coronavirus and 19 people died to date. As each day passed, the number of infected people does not decrease, and there is no vaccine. As a result, there are not many people recovering from self-immunity. In particular, the US is not a mask culture, so hard to see people wearing masks. Rather, if you wear a mask, you will suspect that he is infected. Because of the large US and the large population, there are rumors that even if the virus spread, it will be difficult to care for, but I believe US can care of COVID-19. California has a population of 40 million with only 200 coronavirus diagnostic kits. Request the federal government for additional shipment. It is expected or even more unstable about what the US will do it in the future. So I want you to take it seriously now that the world is anxious with the coronavirus and prevent it from getting infected. I hope the vaccine will be developed as soon as possible, and all of you who are healthy and sick are sincerely hoping for a quick recovery. And see you in the next video. Thank you.